Hello, everybody. Happy December. Time for another Chuck Chat. I'm going to share my screen with you. Just a moment. Here we go. I no longer keep a naughty or nice list. I'm only concerned with who friends me. Black Friday equals back pain, headaches, empty wallet, bruised shin, sore feet. Cyber Monday, tired shoulders, carpal tunnel, eye strain, maxed out credit cards, numb bum. I left your credit card outside, it's still smoking. Sounds familiar. You're bringing friends? We're Christmas lights. When one of us goes out, we all go out. Had that happen to me on more than one occasion. How Santa really finds out which reindeer can fly. Dang, let's try another one. COVID-19 in Westminster update. Since March the 9th, 19 cases amongst our residents, 1 death, 16 recovered, 2 are recovering with light symptoms. We've had 23 associate cases. All but one of those have recovered. The one that's left is recovering at home with light symptoms. Total tested, including resident staff, private caregivers, 2,906. Our infection rate is 1.89%. You can see this is the daily tracker results for the state of Texas. Still very high. We're right in here, which we kind of expected to bump after Thanksgiving. Cumulative cases in Texas, almost 1,200,000 at this point. Independent living visitation reminder, scheduled visits with reception only. Visits may take place in designated areas only. Visits are limited to 2 persons for 1 hour. Social distancing and mask must be worn during the visit. No eating or drinking with visitors. Associates will address residents and visitors that are not following the protocol. Visiting hours continue to be restricted to 8 a.m. to 4 p.m. Phase 2, which we are still in for the most part, even though Travis County is in stage 4. Our phase 2 looks like this. It's staff resident-led activities increased to 20 or less, some limited indoor activities for up to 30 in Harrisville Hall with sign-up sheets, social distancing, and mask. Up to 50 for outdoor activities with social distancing and mask. Laurel Dining Room, I did reduce the capacity to 25%, which is about 30 people. Reservation only as a further precaution with stage 4 announcement from Travis County. Visitation increased as available. Up to 2 visitors per visit, 1 hour designated locations only, by appointment only, 8 a.m. to 4 p.m. Please don't pressure reception to allow visitors at other times or increased numbers. Limited service providers are allowed in independent living residence apartments with appointments set through resident services office, no more than twice per month. Healthcare center visitation, the Arbor. Visitation is currently restricted to designated essential caregivers for a period of at least 14 days more, with no additional COVID-19 cases identified. We'll let you know if that changes. I did want to introduce Ev Chanu. She's Westminster's new wellness coordinator, fitness instructor, and personal trainer. Ev's been around our community for many years. I'm sure she's going to do a fantastic job. So if you see her in the halls, make sure you welcome her. Do's and don'ts. So do wear your mask like London is showing us at the top of this page, just like this, where it covers the nose, mouth, and chin. But most importantly, the nose and mouth. Don't wear it like this, and don't wear it like this. It's not meant to protect your chin. December 2nd, questions and answers. Can large display thermostats be provided for Windsor residents with vision issues? Better yet, would it be possible to link with an Alexa type device so that voice control would be possible? Yes, larger display thermostats are possible if needed. This can be done on an individual basis as needed. The resident would just need to reach out to plant operations through the reception desk to get a work order set up. Voice control may also be possible if they're interested residents. We would be happy to look into this function. So, can be done. There is an additional charge for the devices, but very minimal. Why is only the 4th floor Preston laundry being enlarged? What about those residents on the 3rd floor? Didn't we complain enough? So the ability to move forward with the enlargement of the 4th floor laundry facility was enabled by a vacancy of a studio apartment on that floor that allowed us for the expansion. So we were able to move some folks around and reallocate space that was next to the laundries for us to be able to enlarge that. We will continue to look for opportunities to improve our amenities when possible. The enlarged facilities should benefit all residents regardless of the floor they reside on. And I've known this to be a complaint for many years. I know the 3rd floor would like it as well, and we'll look for opportunities to do that when possible. But this year, at this time, we see that we can make it happen with the 4th floor. Please understand that every time we take an apartment offline, that it affects our revenue. So it does hurt us in the long run in some ways. And though the laundry is nice, I'm sure everybody will enjoy it. When the new fitness area in the infill building is finished, will Windsor residents be able to have the 1st floor storage locker room back? No, I'm afraid not. That won't be possible. It is our intent to move life enrichment to this area. This change will allow for a small meeting room for support groups and an office for Rachel. However, we are having many lockers installed in the Carlisle building, which should benefit all residents. More lockers than the Carlisle and the Windsor should need. So, in the new Windsor Tower building, will there be an office for the wellness coordinator, personal trainer? They will have a space of their own located in the gym, not necessarily an office, but they will have kind of a home base space. Whoops. What is actually happening with the area at the Grove that was going to be the Westminster expansion? Well, I can't tell you for sure. You may want to ask the Grove if you get the opportunity. We don't know what is happening exactly with that piece of land. It is still zoned to be congregate living, according to the PUD that was approved by the city. And my understanding is they haven't tried to reapproach the city to change the PUD. Our understanding is that they still plan to put some type of senior living in that location, and we are aware that there were several interested entities that develop senior living, so it's quite possible that a senior living something gets put across the street at the Grove, but it would likely be a totally different product than what we offer. Why isn't there a hand sanitizer located at the coffee station in the bistro? The dispenser in the hall is a little awkward. I'm not sure why there wasn't one located there, but there will be now. I asked for them to install one yesterday. So thank you for the suggestion. Please pass those along. The new carpet in the Preston Hall has accentuated the need to replace the handrails in the Preston building. Would it be possible to replace the handrails with those that are in the Windsor building or in the hall outside of the chapel? Yes, you know, we started with the carpet because there was some safety issues with it. There were some seams that were coming apart and creating trip hazards, and the carpet was certainly showing its wear. But we do plan, that's the beginning of the renovation of the Preston halls, the corridors. We do plan to skim coat the walls, paint, and also replace the handrails throughout the building. We've received bids for this work, and we plan to remodel the Preston hallways, including the handrails, starting in the first quarter of 2021. We're also getting new dining room chairs and a new bus and things like that. So lots going on in the first quarter of 2021. Recent news reports, this is a question from last time, but I wanted to repeat it, and I wanted to show you some graphs that I use to track the occupancy numbers, the census numbers in our buildings and levels of care. Recent news reports have said that there's a drop in occupancy in continuing care retirement places like ours because of the pandemic and people choosing to age in place. What is our current occupancy level in independent living, assisted living, healthcare, memory unit, et cetera? So I answered those questions last time, but I just wanted to show you the graph since you can see that, since the beginning of the year, we're bouncing along. And then we did hit March. We saw a decline in census and healthcare, but we allowed the decline in census. We continue to get inquiries from hospitals and others trying to get into our healthcare center, but we chose to, really be cautious and deny admissions from the hospitals. And outside of Westminster, we really locked down to a degree and maintained all of our empty beds to serve our life care residents, serve you. So we thought that was a good precaution. And then we could not get a guarantee from the hospitals either that they would test every patient upon before they discharged. So our numbers are coming back up a little bit. And we're allowing them to because we developed a COVID isolation wing, which has helped us. But we're still continuing to be very cautious. We're not accepting short-term rehab admissions from the hospital. We're only accepting long-term patients or our life care residents only, and we test everyone before they come in. Just a breakdown on the occupancy in the healthcare center, you can see that the life care numbers are slightly below what was budgeted. So the budget is the blue line, and this is what we're running the actual, pretty close to budget. Medicare number has been much less than budget, and that's due to us not taking outside admissions. We continue to get lots of inquiries, but we just haven't taken those admissions. And then the private is right here. It's pretty close to budget, couple down from budget, but you can see that the budgeted occupancy was supposed to be 79. It's been running around 70, 71 for the most part on average. Assisted living occupancy is right where we want it. It typically bumps around, but most of the time is at budget, which is 21 units out of 22. It's 100% occupied today, so it'd be up here. What causes those is this is long-term care mostly, and occasionally we have a vacant apartment that we refurbish, and it takes a little while for us to turn those apartments around. Independent living occupancy was doing really well. We did take a little bit of a dip starting in March, and then carried through till May, and then we started to see an incline. So we're running about average for the year. The last 2 months, we're, like I said, it's like 94.8%, budget's 95%. So really good, really doing well. A lot of traffic coming through, especially coming through the marketing department. Speaking of marketing, there, just to update you, Jordan Bleeker has been selected for the marketing sales director. Jordan's been with us for almost a decade. She's been executive assistant to the community administrator when Hope was here. I hired her originally for healthcare center admissions coordinator, and she's also been residency counselor, very successful residency counselor for the last couple of years. I'm sure she's going to do an excellent job. Kim Reese is still with us, residency counselor as well. Just to kind of give you an idea what the team looks like. So I honestly believe that this is the right team to move us into the future. Kim Reese, residency counselor. London Clary, community relations coordinator. She helps with renovations, selections, move-in coordination, and communication. Tessa Gonzalez is new to our team, but she's helping with the selections and events. Selections on the Carlisle and the Windsor expansion. She also helps with social media and engagement. Megan Rapp, she's administrator coordinator. She's a receptionist in the lobby and administrative assistant to the department. If you have any questions or you want to pass along a referral or something, just give marketing a call. The direct line to marketing is 512-454-4643. I do believe it's a plan for success. I'll be, like I said, helping out in marketing for the next couple of months, supporting the team. We're working on a marketing plan, training, meetings, and coordination within the department. I'm also coordinating with the advertising agency and public relations firm and the regional support from Life Care Services. We're completing the selection process for the Carlisle expansion, which is very important, has a deadline of the middle of January, and we'll eventually transition London and Tessa in January, February to backfill Jordan's residency counselor position. So we're looking to possibly promote London and then backfill Tessa into London's position. We also have LCS regional support from Tim Hamilton, who can, he's on weekly calls with us and helping support Jordan as well. Just providing a little bit of a construction update. That hole is really getting deep. So it's about where it should be now. The mass excavation is mostly over. They're just removing dirt from the hole. The shoring has been mostly completed at this point. You can see that they're starting to dig for piers. This is a little fuzzy. Sorry about that. But the Windsor infill is preparing to start its construction. Sanitary waste line for Windsor infill is being installed. These are the parking stalls that are closed in the visitor parking area. The work should take about a week. Bridge number 2, which is the bridge behind the Bistro Kitchen, is ongoing with the completion approximately the end of January. Structural steel is already being in place. Electrical work inside Windsor level 3 and 4 hallways is ongoing and should be completed at the end of December. Demolition at Windsor backup generator area should have started and been completed. Windsor pool windows are being installed this week, and waterproofing. That's for the frames and the waterproofing. And I do appreciate your continued support and patience with the construction activities. I know the demolition is the noisiest part of construction anytime. It's been rough over the last few days. So I really do appreciate everybody supporting that. I'm gonna just leave this spreadsheet up for a couple minutes, but you can see the shoring that's being completed, and then the footings that are being dug, remaining piers on the Windsor infill being completed this week. The electrical rooms, which is really not something that you maybe noticed, but it's being completed. The courtyard, a lot of the courtyard work is happening really quickly and it will be happening over the next few months in hopes to get that Windsor courtyard back online in time for spring. That's the intent. Bridge number 2, so they'll start working on the exterior walls and the parapet framing, sheathing. So that'll be all occurring this month. So the bridge will start to take shape, and that will be an air-conditioned bridge. So just to give you an idea, that bridge runs along the back side of this area right here. So it's the Bistro Kitchen sits here, and this is the bridge that will help connect the pool to the Preston building. The other bridge that we're getting is up here, and that has not started. So, and it won't start until the Carlisle comes up out of the ground. The selections process, I talk a lot about this, but basically we have completed selections on the Windsor Tower. So the charter members have made their selections, and we have designed and finished their design for the apartments, and that is on schedule. We've also completed 35 Carlisle charter members with first appointments. 6 of those have finalized so far. The Carlisle selections will be finished throughout December. We will hopefully be finished with all of the selections by the end of the first week of January. Approximately 90 priority members are waiting still for apartments. So if we have somebody fall off of the Carlisle and choose to come to Westminster now, we can backfill those cells. 2020 building and grounds for the current buildings. Preston interior window work. We've completed 218 apartments, should be finished at the end of December. The solar film is underway. Approximately 10 apartments have been completed. We have about 49 to go. This number is probably a little higher completed than when I shot the slide. Lobby and dining room renovations is completed. There are some artwork pieces that will be changing in locations after some resident suggestions. Preston flooring replacement, lobby and dining room complete. Third and fourth and fifth floor are complete. The Preston heating and air conditioning system, the cooling tower has been replaced. The chiller work has been completed for the most part, and we will be removing the mobile chiller soon over the next week or two. The fourth floor laundry room will be enlarged. This project should begin this week or early next week. We just signed off on the bids for those. Just a reminder, on Wednesdays and Thursdays between the hours of 2 and 4, we will continue to offer tours of common spaces and apartments to prospective residents. Tours will be limited to about 30 minutes. All individuals are being screened prior to coming on campus and then again once they arrive. Just some more reminders. Always wear your mask when outside of your apartment or when receiving services in your apartment. Maintain at least 6 feet of social distancing at all times. You need to do both for the mask to work. Do not touch your face, eyes, or mask. Wash your hands often and practice good hand hygiene. Limit gatherings and meals with others. Limit leaving Westminster to essential trips only. Travis County is really, Travis and Williamson County are doing really badly right now with the amount of COVID cases. In fact, almost as high as when it originally started. So we need to be really diligent about restricting our trips to essential purposes. Limit contact with individuals from outside of Westminster. Limit visiting restaurants, bars, outside salons. Limit holiday visits with families to small numbers. When visits occur, please limit numbers to 5 or less total. Limit time for visits to no more than a couple of hours. Limit travel and overnight visits. An update on Alzheimer's Texas fundraising. We have a new total, $77,268.19. The committee did a fantastic job this year, and thank you for your efforts. Happy holidays, everybody. Stay strong, stay safe. Thank you for all you're doing. Appreciate your support and the kind letters and notes that you send me. Those really make my day. Thanks for making Westminster a great place to live and work. Until next time, bye-bye.